Hello, I'm Perrin Beatty, and welcome to the Business of Business. Throughout the pandemic, we'll be having a series of conversations with leaders, both from government, the private sector, from experts in the medical profession and others with regard to the impact of COVID-19 and the pandemic and what it is that we can be doing to respond effectively to it. Well, as we head into a new and potentially more dangerous phase of the pandemic, the pressures, financial, physical, and mental, continue to mount on Canadians. While our primary focus remains the physical spread of the disease, less visible but still extremely dangerous is the mounting toll that COVID is taking on the mental health of Canadians. A recent poll found that 50% of Canadians reported worsening mental health since the pandemic began, with 44% feeling worried and 41% more anxious. 1 in 10 Canadians polled said that their mental health had worsened a lot as a result of COVID-19. Now, similar results were found in a survey of Canadian workers where 81% reported that the pandemic is negatively impacting their mental health, indicating a significant drop in overall mental health since the beginning of COVID. My guest today is Mark Fitzgerald. Mark was appointed President and CEO of PETRONAS Canada in November of 2016. With more than 29 years of experience in the oil and gas industry, Mark has held senior executive roles in production, development, operations, strategy, and corporate development. He has an extensive and distinguished background in the sector. He's the outgoing chair of the Board of Governors of the Canadian Association of Petroleum Producers, and he's on the board of directors of the Shock Trauma Air Rescue Service, in addition to having a long-standing involvement with several voluntary organizations. Mark, welcome to the Business of Business. Thank you so much for joining us today.
Yeah, certainly. Thank you, Perrin. And so happy to be here to talk about this. This is such a wonderful topic to speak openly about. Thank you.
It's a critical issue, and you put your finger on my first question just in your comment right there. One of the issues, obviously, in dealing with mental health is the reluctance that people have about discussing it openly. Unlike physical problems, people would freely discuss whether or not they've been exposed to the AIDS virus. We're reticent about discussing the strain on our mental health. How do we bring it out into the open and have a more open and free dialogue about something so important?
Yeah, I think, Perrin, you talk about really the crux of the challenge that we deal with. When we think about the corporate world, we're always very open about speaking about physical health or the health of our safety of our workforce, whether it's in the office or in the field. If somebody's ill and physically ill, then the full weight of the organization typically goes to support them. And I think it's wonderful. It's wonderful how companies have evolved to really focus on that physical safety and the physical health of employees. But here's a fascinating statistic that I learned a couple of years ago that has really struck me. The average time for somebody in a workforce who begins to suffer from an emotional well-being challenge or a mental health challenge until they actually reach out and seek help is 7 years. So for 7 years, that individual is not at their peak. They're struggling to contribute. And as we know, that there's a very, very strong linkage, at least I believe there's a very strong linkage, and the research would support this, between the mental health and the emotional well-being of an individual and their capacity and competence to be safe on the job site and to contribute on the job site. And so from a corporate perspective, it shifts to not only caring for our employees and ensuring that we look after their emotional well-being and their families and the contribution to community, but there's a very, very strong case to be made that there's an opportunity to tap into that real effort and opportunity to contribute that people have by supporting them to be capable and competent and able to do that. 7 years of somebody not being able to be at their full peak creates just a significant gap in what corporations can deliver and contribute.
It's inconceivable. If we were looking at a physical disease of cancer or heart disease, it's inconceivable that we would leave this for 7 years, allowing it to grow without addressing the issue.
Yeah, it's something to me. I'm very open and transparent with people. I was diagnosed with cancer 4 years ago. early and caught it. And when I look back on that time, and this is when I became very, very passionate about mental health. The physical care that I received was unbelievable. It was just top tier. I felt safe. I felt looked after, and the outcome was very, very good. I'm in very, very good shape because of that physical care. The emotional support, and when I reached out for that emotional help, it was very poor and relatively non-existent. And so for that period of time, as a CEO, I was receiving the physical care. I was in good health. I was able to do my job physically, but in terms of the actual emotional just ability, if you will, to be fully competent in that role, I wasn't. And so it really highlighted for me the opportunity to create that safety net and that awareness that allows people to put their hand up at any point in time and say, I'm not okay. I need some help today. I need some help to be able to contribute to my full potential today. So that was a major awakening for me in terms of the opportunity that exists to create that safe environment and that awareness for people.
The extraordinary thing, Mark, is that with any other issue, you wouldn't be expected to suffer in silence.
Correct.
And yet being forced to withdraw into yourself, to try to keep it private and to deal with the challenges you're facing can be exacerbated by the fact that you can't share it with others, and you don't have the opportunity to avail yourself of the sort of supports you would have with any other problem.
Yeah, no, you're exactly right. You're exactly right, Perrin. One of the things that I also want to share that I think is, it was insightful to me as well, and I'll reach over and read this, but the World Health Organization has a definition of mental health, and they don't define it as an illness. They don't define it as a disease. They don't define it as something that any of us should be ashamed of. This is how they define it. So they say mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. So it doesn't speak to illness, it doesn't speak to problem, it doesn't speak to challenge, it speaks to what I think is a fundamental right or opportunity for individuals, and that is to be able to contribute to their full extent. That's what the focus on mental health is. One of the big opportunities we have in our organizations is exactly what you talked about, is allowing people not to suffer in silence, but to actually reach out for support. When we talk to people in our organization, the reasons that they give us for not talking about the current emotional well-being is they're scared that it will create a paradigm around their name that will harm their future potential, their future promotions. It will create a stigma that this individual perhaps is not able to challenge or handle the stresses of the job. Perhaps I will lose prestige in the eyes of my leadership or in the eyes of my peers. And so what happens is individuals, as you talked about, will suffer in silence. They're scared of the outcome or the consequence if they bring forward that challenge that they're facing. And as a result, you continue to see a deterioration in performance that impacts families and children. It impacts the community, and you end up in this real significant negative loop that only gets worse. Where a simple intervention, could do wonders. It could do wonders.
Throughout COVID, we have had a very good count in terms of the number of people who've been infected. We track that very closely. But we have less information about the collateral damage that has been done by COVID. Family breakdown, drug addiction, family violence, mental health, and the like. Are we doing an adequate job of tracking the impacts of the pandemic upon the mental health of Canadians?
Yeah, absolutely not. No, I think absolutely not, Perrin. I think there was already, before COVID, there was already a real gap in how we addressed, understood, and created safe environment for people to heal as it relates to mental health. And as you've highlighted, as we've transitioned into the last 2 years of COVID and what seems to be, a reemergence and continuation of very, very difficult times for us in the future, we talk a lot about physical health, physical symptoms associated with COVID, long haul COVID physical symptoms, the importance of testing, the importance of staying in your home, the importance of social distancing. But we really, really don't speak to how to help people cope with that change around them. So while we're doing everything possible, and people, I think, for the most part, are doing everything they can to be physically safe and to protect themselves from this nasty virus and honor the expectations of our public health authorities, the support network is not there emotionally. And as I said, we didn't start in a good place, in my opinion. It's not like we came into COVID where everybody was in a wonderful state of mind. We've seen significant challenges around the world, both economically, socially, environmentally, that were already exacerbating these challenges. The pace of change in the globe is unbelievable right now, right? And having 2 young kids, 24 and 26, I look at what they're dealing with at that generation as they go through, and the mental stress that they have. Throw COVID on top of that, and we need to find a way to allow people to heal, because that 7-year time period is just so destructive, both in terms of communities, families, and business.
Now, the great irony here as well is that perhaps the greatest stress is upon our frontline workers who are helping to try to deal with this disease. The University of Regina has done a survey looking at health workers, and they concluded that nearly 1 in 4 workers are probably experiencing mental illness. Mm-hmm. And 44% of healthcare staff who are surveyed are more likely to leave their profession compared to before the pandemic. So those people who we are asking to carry the greatest burden are themselves suffering even more heavily than the rest of us. Yeah,
I agree, Perrin, and I've seen that firsthand in my role with STARS in Western Canada. The frontline workers are heroes without a question, whether they're medical, service provision, retail, anything that's being done to provide service to the public. Those people are heroes, absolutely heroes. And they're doing their jobs and conducting what they do with an eye to the service of others. Right? So when you think of doctors, nurses, all of the healthcare workers, I'm certainly passionate about what I see at STARS. Now they're doing it for the most part without complaint. And I can't thank them enough. They truly are heroes in my mind. That approach, while beneficial to you and I, is going to create, as you've talked about, in my opinion, a real significant challenge for those individuals and for our society as we come out of COVID. There's going to be fatigue. There's going to be resentment towards those that, that perhaps took risks and got the disease and required healthcare. There's going to be a healing required and a time to recover from that I'm not sure our society understands or expects or will allow. And so again, I think it's having this conversation around how do we allow those individuals to heal? And as if I go right back to the World Health Organization's definition, how do we allow them to contribute to the best of their abilities and to do so in a manner that's healthy for them? So I share your view. I cannot thank those individuals enough for what they're doing. But I really wish, as a society, as governments, and as business, because we have a responsibility as business to step into this space, that we provide support and care and tools for them to heal.
We talk about long COVID. One of the impacts may be long COVID mental health problems, PTSD for people who've been affected by it, either in contracting the disease themselves or in having members of their family do so, or workers having to deal with the strains of coping with providing services during all of this. It's not something that simply is going to go away as the disease itself recedes.
Oh, I think, you know, the impacts that we're seeing just from lack of human relationships, you know, we see that in our office. You know, we've had our office closed for 2 years and we keep trying to reopen it, but we can't. People miss the day-to-day interactions. They miss the day-to-day relationships. They miss the opportunities to go to dinner and movies and blow off stress, or go, you know, watch your favorite sports team, kids activities, you know, just all these things that are sort of natural mechanisms, I think, for people to, you know, to gain that support and gain that structure that they need, are missing. They're absolutely missing. And so, you know, I think you're right that, you know, we're going to come out of COVID, and we will come out of COVID, right? Between science and medicine and people's commitment to do this right, we will come out of this. I think we have to recognize that there's a real need to create those safe environments for people to put up their hands and say, I'm not okay. You know, the way we think about it at our company is, before COVID, sort of global research said that the impact of mental health on lost productivity in businesses around the globe was $1 trillion a year, $1 trillion US dollars a year. I can't even fathom that amount, of which about 20%, 25% was in the North American concept. That's the benefit just to companies to go after this. Yes, there's a societal and a responsibility to our employees and families and community, but there's also a 4.5 to 1 return on investment for us before COVID. And I would argue that, you know, as we've come through the last 2 years and we seek to reemerge as businesses from this, that 4.5 to 1 is probably 5, 6, 7 to 1 in terms of the investment in employees' mental health. The other example I use in our company is, you know, many businesses do high risk work. You know, we're in an extractive industry. A great many of our employees do dangerous work, and I thank them every day for what they do. But could you imagine the power if somebody in that situation came into the office, came into their, you know, their field operation or their manufacturing plant or wherever they are, and they were able to put their hand up and say to a peer, you know, I'm struggling today. Like I'm having a tough time today, and like, could you just maybe go for coffee with me and let's talk about it? Or could you spend the first couple hours of the day with me to make sure I'm safe? Because I'm worried that when I'm distracted, I may make a minor error in what I'm doing, which can lead to a disastrous consequence. The power of that peer-to-peer conversation is immense, and that ability for somebody to reach for help. That's where companies have to create that safe environment. You know, there has to be no consequence, there has to be a reward system, and there has to be an ability for that employee to walk into whatever job they're doing to say, I'm not okay. We talked right at the beginning. You know, I could do that. I could come in and say, I got a really bad sore throat and a bad headache, and, you know, or whatever. And everybody would go, yeah, I get it. Totally. Yeah, go home, go look after yourself. We have to create the same for that emotional well-being, for that mental health side of the business.
You certainly make a compelling case in terms of the humanity of dealing with these issues, and the fact that it's a matter of fairness in terms of how we deal with each other. But you also are making the case that this is good business as well, that from straight bottom line considerations, the investment that we make in ensuring people's mental health brings a commercial return.
Yeah, and it does. You know, I am absolutely adamant that the commercial return to Canadian business is immense compared to the investment that we can make in this space. As I said, international research before COVID was a 450% return on any investment in an employee's mental health. The second way I think of that is, you know, as I talked about, we're seeing a rapid globalization. We've seen it for a number of years. It continues to accelerate. The boundaries of business are no longer city, province, country. They're very much global. And so, you know, as we look for what is that competitive advantage for Canadian business on that global stage, certainly it's pace, it's speed, it's innovation, it's some of the technology advancements that our country is so good at. But the power of that engagement of our staff and the employees and giving them, right back to the World Health Organization definition, the opportunity to step in and be the best that they can and contribute outweighs, in my opinion, anything that we can do physically or in terms of manufacturing investment or pace, because that's the lifeblood of our business. And so, you know, I work for an international company. We're operating in over 90 countries around the globe. You know, I do think I bring a reasonable perspective in terms of international business. And I believe that the focus on mental health by Canadian business, the emergence of the narrative by many, many CEOs in this space, is going to drive a real opportunity for Canadian business to kind of lift up that efficiency, productivity, and it's all going to come because our employees go, you know what? Yeah, they care about me. I can heal, I can develop here, I can build those skill sets in a safe environment because I'm looked after. My family environment's much stronger because I go home in a much more positive frame of mind than I do sometimes, and my community is stronger. And so if we think about, you know, the ability to link community to family, to employees, to business results, you know, I'm incredibly passionate about that opportunity for companies to make a difference in that space because it will drive a competitive advantage for us.
Can we talk for a minute about PETRONAS itself and what you're seeing there? You were mentioning earlier that you've been working remotely for almost 2 years now, same way as the Canadian Chamber. We moved to remote work back in March of 2020. What are you seeing within the company? How do you measure the mental health of people when they're not in the office? And what are you doing in terms of dealing with people's mental health when you're not seeing them, when they're located at home?
Yeah, we've done a number of things, Perrin, and I think we're early in trying to do the right thing. I think we're a long way from successful. So some of the things we do is, you know, we've adopted what we call a mental health plan for all of our executive, and that will be rolled out to every single employee in 2022. So, for example, you know, I have a consultant that I work with. It's a private individual, and I lay out everything that I feel I need to do to focus on my emotional well-being and my mental health. Nutrition, exercise, what are my triggers, how do I rest? And then we review that every quarter independently to make sure that we're on track. We're going to roll that out to every employee in our company in January and create individual mental health plans, and we'll support them so that it's unique to them. It allows them a safe environment to have that conversation with a professional. They don't have to have that within the company if they don't feel safe. So that's number one. Two is
it is kept private. It does not go back to the company.
Does not go back to the company. Absolutely not. It's kept private. And if an individual wants to share about it, great. You know, if they want to, and I share mine transparently with the company, just trying to set that example. Most people laugh at me when one of my things is to eat better lunches, because if I eat a lousy lunch, I'm usually asleep by 2:30, and they all laugh at me because every time I have lunch now, they are testing what I'm having for lunch. So there's a little bit of fun that goes with it. The second is just communication. I do just little handheld videos talking about where the company's at, how we're doing, focus on some of the mental health topics, trying to create, again, connection, because as people work from home, they lose the connectivity to the company very, very quickly. And so we have some fun with that. And, some have been good, some have been not good, but half the fun of doing them is they're not always great. They're always just kind of unique. We have developed tools and training programs and resources through a mental health hub that's on our ProNet page. We hired a wonderful lady named Lorene McNeil, who is was the executive director of the Calgary chapter for Canadian Mental Health Association, and said, you have a clean slate. Whatever you think you need to do in there, you do. And we've given people every opportunity and every right and permission to step away when they need to step away. So we've said, if you feel you need to step away for a day or 2 days or a week, I want you to step away. I would say that's probably my biggest disappointment, is I'm not sure people feel safe yet to do that, because it's one thing for me to say, do that, but culturally in our organization, I'm not sure that's worked its way all the way through all of our leadership and all of our company, where people can say, okay,
Still the sense that you're going to be judged.
Still that sense, yeah. And so we have some work to do for sure. But the best thing, I think, is I just keep talking about it. And I think if people recognize that I'm very consistent in my message, I'm very transparent and open in sort of my own state and my own experiences, then hopefully it creates an environment where people say, well, if my CEO is talking and speaking transparently and there doesn't seem to be any negative consequence for him, then okay, maybe I'll take a risk. And as people bring forward, the one thing that we talk a lot about is we have to be prepared to catch them. So if somebody has the courage to step up and say, I'm struggling, man, you better catch them, because if we don't, we'll lose them forever, right?
Mark, just as physically, the impact of COVID has been uneven across various groups. Now, surveys are showing that the mental impact of COVID has been uneven as well, that women, for example, appear to be harder hit than men. The explanation that's usually given for that is that with people on lockdown, with schools being closed for much of the time, that women found that extra burden put upon their shoulders, and as a result, we're suffering from extra strain. What have you found? Have the impacts been uneven within your own company?
Yeah, I think they have, because I think the responsibilities are uneven, and I think you're absolutely right. We live in a society that's doing its very best over the last number of decades to increase the focus on diversity, inclusion, equality. We have a long way to go. We have a long way to go in that. So again, similar to my comments around where I felt mental health was in our business before COVID, we still had diversity, inclusion, and inequality issues coming into COVID. And in terms of the responsibilities through that, our female workforce are dealing with children, parenting children, school issues, many things that create additional stress and additional strain on top of corporate environments in Canada that I firmly believe haven't yet reached that objective of diversity and inclusion and equality. And so we're certainly seeing a disproportionate level of stress in that group. PETRONAS, to their credit, globally has reached out and created a women's network where they can share safely peer-to-peer, talk about the individual challenges that they're having, look for different resources and opportunities to, again, create that safety and that healing. The best thing that we can do as a company, I think, is acknowledge that it's real, acknowledge that the stressors placed on our the female workforce is disproportionate to the male workforce for the most part. I know there's different circumstances that where that's not true, but and give them the support and the space they need to contribute. So all part of, Perrin, I think, this evolution that's occurring in Canada and in the business community around better support for mental health, better support for emotional well-being, better support for families, better support for communities. And it all ties together with the efforts around diversity and inclusion and equality, because that whole mix, again, in my opinion, based on a lot of time sitting behind executive desks, is that lifts the whole corporate community up and makes us much more competitive. I mean, it's just a fantastic opportunity for us.
Mark, the other group, when I look at the Chamber's workforce, we have had quite a few people who've joined our team over the course of COVID. I've met their cats and I've met their children over Zoom, but I haven't had a chance to meet them in person. And this is one of the groups I'm particularly concerned about. We have many communities that we belong to that give us support during times of stress. One of those, obviously, is the community at the place that we work, where we know one another and we have relationships. I believe that it's probably considerably more difficult for new people coming in who don't have personal relationships with their colleagues, in addition to all the other stresses and strains of COVID, for them to be trying to work their way through who are the people that I'm dealing with? What are they like? How do we build that relationship? Are you finding the same thing in your workforce?
Yeah, it's terrible. Like, I don't even know how to describe that. The number of people that have come into our workforce who haven't actually been in the office yet is just incredible to me. And you're right. How do we help those individuals feel part of something, part of the company, when they've never been in the office? They've never actually been in the building. We constantly encourage, subject to the public health regulations and what we're allowed to do. You don't have to come into the office to meet your team. If 2 or 3 or 4 of you want to go out for lunch in a safe environment and meet each other, I'll pay for that. Absolutely, I'll pay for that as a company, because again, the benefit to the company is building relationships, committed employment, and as we talked about, 4.5 or more return on that investment just by helping people feel part of the company. So while we can't bring our entire staff back into the office yet, we can't create that environment that people feel inclusive to and part of. And even just simple things like holiday parties, we can't do those, but we can do the smaller stuff. And so again, we've encouraged the organization, reach out, take each other for coffee, go for dinner, take your spouses with you if you want, so you can again create the relationship and the feeling of belonging that's so important to people right now, because it's missing, and it's hard, right?
Mark, you're modest both about what you are doing personally and about what PETRONAS is doing to promote mental health in the workplace. But you are light years ahead of so many organizations, both in the public and the private sector. Outside of PETRONAS itself, what are you and the company doing to promote a greater understanding on the part of the business community about the need for mental health?
Yeah, I sit, Perrin, on the Calgary, started with the Calgary Stewardship Council, which I think was a real strong initiative by Mayor Nenshi at the time, a lady named Karen Gosby, who's a real advocate in the space for mental health, and a fellow named Dr. Chris Eagle, who was the ex-head of Alberta Health Services. They came together and said, can we bridge corporate sector with education, with all the associations, with the city, and find a way to more streamline and create these linkages? I think it's world leading what's going on there, and the city continues to do that under our new mayor. So that I think that's part one. Part two is there's a real appetite amongst businesses to have this conversation, and so we also sit in conjunction with many of our peers, not oil and gas peers, but just industry peers across the province of Alberta, to talk about how do we create commonality in support for our employees and their families. So I may say, well, if I've got the best ever employee support programs and best ever mental health programs, that's a competitive advantage for me. But we got to think beyond that. If we can create a commonality where anybody from our company or any company in Alberta can go to a common place and seek peer support, amongst a broader group, or shared resources or professional help, again, that's shared. The efficiency of that is incredible. The ability for that to then bridge across to the wonderful associations that provide support, the school boards that are integral to family mental health. That's what we're really trying to accomplish. And, Perrin, what I've seen is there is a real acknowledgement and appetite amongst my peers to do something. I think everybody recognizes that, this is not only a social responsibility for us as organizations, but as we've talked about earlier, there's a real business driver to be able to do something in this space. And so my hope is that this kind of groundswell of conversation that is going on is now taking a whole new light through the work of the city, is now taking on a new opportunity through the work across many Alberta businesses and associations to make a difference. And then that competitive advantage starts to become clear, and it moves across Canada. And as I said, I am a big believer that sort of just the Canadian culture lends itself well to people helping people, to businesses creating that competitive advantage, and to creating just an opportunity on the global stage to really advance what we think is the Canadian advantage.
Mark, thank you. Sadly, we're out of time, but it's been a fascinating half hour. And there are really three lessons that I take out of it that really stand out to me. The first is that the issues are real. We need to address them. Secondly, that we have to move it out into the public and have an open and frank discussion and not be afraid of addressing the issues. And then third, the encouraging thing is that there's something that all of us can do about it. And in particular, there's something that those of us who are leaders in the business community can do to make a very genuine difference that will have a real impact in people's lives and on the bottom line, as you point out.
Yeah, I think that's very well said, Perrin. And to yourself and to the chamber, thank you for the opportunity to share what I think is a really important and passionate conversation around well-being and mental health. And I think it's something that we, as you talked about, we just need to talk about. We need to have the conversation about. And I think if I can encourage everybody that listens to this, just have the courage to be open and honest. And that groundswell will carry the conversation of the day. But thank you. Thank you so much for the opportunity.